Hey, I'm Jamie Perkins, and this is my health assessment video. This is Mr. Robert Perkins. Do you consent to allow me to do this assessment?
Yes.
Do you understand that all findings will remain confidential?
Yes.
To start the assessment, I first start by inspecting the face. I'm looking at the skin. I'm looking for symmetry of all the facial features. At this point, the features are symmetrical. Next, I'm going to palpate the cranium. I'm looking for tenderness as I palpate. I'm also looking for any protrusions or bumps. No bumps are noted. Is there any tenderness? Do you feel any tenderness?
No, not at all.
Okay. Next, I'm looking at facial expression symmetry. Then I'm going to palpate the temporal arteries. I'm looking for hardening or tenderness. Does this feel tender when I press?
No.
Any tenderness noted?
None.
Okay. Next, I'm going to palpate the temporomandibular joints. I'm checking for TMJ. And I'm going to place my hands at the temporomandibular joint. I'm going to ask the patient to open his mouth and close, and open and close. At this point, I would be looking for clicking. No clicking was noted. Next, I'm going to check cranial nerve 5. I'm going to ask the patient to clench his teeth. As he's clenching his teeth, I'm applying pressure to the jaw, trying to push it open. This tests muscle strength, and the muscles are strong. Next, I'm going to perform the sensory function test. I'm going to ask the patient to close his eyes. When I put the cotton swab to your face, I want you to tell me when you feel it.
Now. 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 Now.
No abnormalities of cranial nerve 5 were noted. The last assessment of the face is the cranial nerve 7. I'm going to ask the patient to smile, noting that the smile is symmetrical. I'm going to ask the patient to frown. The frown is symmetrical. I'm going to ask you to close your eyes tightly. Close them tightly. I'm going to attempt to open them. I was unable to open them. I'm going to ask you to lift your eyebrows. Lift your eyebrows. I want you to show your teeth. And then I would like you to puff your cheeks. Cranial nerve 7 is intact. At this point of the exam, we're going to test cranial nerve 2, which is visual acuity. We're using the Snellen eye chart, which is across the room. I'm going to ask the patient to cover one eye with the card. At this point, we are assessing the right eye. Can you call out the smallest line? The smallest line you can see. This is without the patient's glasses.
FTEO, I guess. Third one down.
Okay. And the next to smallest line?
No. That's not distinct, any of them. No.
Alright, so if the third line is the smallest one you can see, what's the bigger one?
That's it.
What's the bigger line? The next is smaller.
BC
Okay.
is up. F is up.
Okay. And then change eyes. And tell me the smallest line you can see.
No, it doesn't change any. It's the same.
Which, can you read the letters on the smallest line that you can see?
Nah, BC and F. That's it.
Okay. Now I'm going to ask the patient to put on his glasses.
Thanks very much for that.
Okay. Now tell me this. Cover your left eye. And tell me the smallest line you can see.
Yeah. GTCL. I'm not sure. FE maybe.
Okay. And then the bigger line, the one above it.
BLFED.
Okay. Now switch eyes. Okay. Now the smallest,
You forget it.
the smallest line that you can see.
No.
Read.
Yeah,
the small-
BC is the second one down, and F is on the top, and that's it.
Okay. Now read. Now without using the card, tell me what's the smallest line you can read.
GOCLT. S maybe. BE. B some BCFED. PTEO, BC, and F. So I can go down that fourth one down.
The patient has reported to me that he does have cataracts, and so at this point, the two lines that he was able to read were the first two lines. Now I'm checking cranial nerves 3, 4, and 6. With cranial nerve 3, I'm looking at the eyes and I'm looking at the width to make sure they are symmetrical. Next, I'm checking cranial nerve 4, in which I will be checking the pupils. I will use my pen light to check for light reaction, and then I will check for accommodation. So if you will stare at me, stare at my nose. At this point, I'm checking the pupils' reaction to light. I'm making sure that the pupils constrict. Both of them constrict. Next, I'm going to check for accommodation. I'm going to ask you to focus on a distant object. I'm going to place the finger in front of the nose, and if you will adjust your focus to my finger. At that point, I was looking to make sure that the eyes accommodated at the same time and were equal when they did. Next, I'm going to check cranial nerve 6 with the cardinal positions of gaze. I'm going to ask you to look at the end of my pen light and just, with both eyes, follow the end of the pen light. No abnormalities were noted. Next, I'm looking at the external eye structures. If you'll close your eyes, they're symmetrical. If you can open your eyes. I'm also checking the eyebrows. No swelling or puffiness is noted. Is that tender?
No.
No. Okay. Next, I'm going to look at the conjunctiva and the sclera. I'm going to pull your eye down. Keep them open. I'm looking for any redness of the conjunctiva, and I'm making sure that the sclera is white. Next, I'm going to you keep looking forward. I'm going to shine a light across the eye. I'm looking for any abrasions or scratches of the cornea or the iris. None are noted. Next, I'm going to assess the ears and assess hearing. I'm looking at the ears. I'm looking for symmetry with the ears. I'm also looking for coloration of the ears, making sure that it's consistent with the facial color. Next, I'm going to push on the tragus, and I want you to tell me if you feel any tenderness.
No. No.
Okay. Next, I'm going to test cranial nerve 8. This is the whispered voice test. So what I will do is I'm gonna ask you to occlude one ear, occlude your right ear. I'm gonna cover my mouth and I'm gonna whisper some words to you, or some letters, or some numbers to you, and I want you to repeat them back to me.
286.
I'm gonna do it one more time.
287.
Okay? Next, I want you to occlude the left ear. Repeat back to me what I whisper.
5B3.
Yes. Next, I'm going to perform the Weber test. I'm going to use this tuning fork, and I want you to tell me in which ear you hear the sound the loudest.
I guess you're right.
I'm going to do it one more time.
Same.
Okay? Next, I'm going to perform the Rhine test, testing cranial nerve 8. I'm going to start with the right ear. I'm placing it behind the ear on the bone. One more time. You tell me when you can no longer hear it.
Now.
Okay? Now I'm going to place it in front of the ear. Tell me when you can no longer hear it.
Now.
Okay? Now I'm going to test the left ear. First, I'm going to place it on the bone. I can't hear it. Tell me when you can no longer hear it.
Now.
One more time in front of the ear. Tell me when you can no longer hear the sound.
Now.
During the whisper test, the patient was unable to hear or unable to report back to me what he was hearing when I was assessing the left ear. I noticed that the patient told me earlier in our health assessment that he has been experiencing ringing in his left ear, which made him unable to repeat back to me what I was whispering to him. Next, I'm going to inspect and palpate the nose. I'm noting that the nose is symmetric in midline. Next, I'm going to ask the patient to occlude each nair and inhale. Occlude one nair. Inhale. Okay. And occlude. Alright. That is checking for patency of the nairs. Next, I'm going to palpate the sinuses. I'm palpating under the eyebrows. No swelling noted. Next, I'm palpating the maxillary sinuses. No swelling is noted. Any tenderness as I palpate?
No. No.
And that concludes inspecting the nose. Now I'm going to inspect the mouth. I will to use my pen light to look at the mouth. Say ah. I'm noting that the patient has dentures. I'm going to look at the buccal mucosa, which is pink. No ulcers noted. They look healthy. Dentures intact. I'm also going to grade the tonsils. If you'll stick out your tongue, say ah.
Ah.
The tonsils are noted to be +1, and the uvula, when he said ah, moved upwards, which is cranial nerve 9 and 10. Next, I'm going to check the gag reflex. I want you to say ah.
Ah.
Gag reflex is intact. Now I'm going to check cranial nerve 12. I'm going to ask you to stick out your tongue. And symmetry is noted. I'm going to ask you to say light, tight, and dynamite.
Light, tight, dynamite.
He was able to say these words clear and distinct. At this point of the assessment, I'm going to palpate the lymph nodes. I'm starting with the preauricular lymph nodes, which are in front of the ear, and then the posterior auricular lymph nodes, the occipital lymph nodes, the submental lymph nodes, the submandibular lymph nodes, and the jugulo-digastric lymph nodes, the superficial cervical lymph nodes, the deep cervical lymph nodes, the posterior cervical lymph nodes, and the supraclavicular lymph nodes. At that point, I'm looking for any kind of swelling, which no abnormalities were noted. Next, I'm going to assess range of motion. I'm going to ask you to touch your chin to your chest. Alright, look back at me. I want you to turn your head side to side. Okay. I would like you to touch your ear to your shoulder. Ear to your shoulder. Ear to your shoulder. Can you turn your head? Okay. I would like you to extend your neck backwards. Okay. And then I'm going to place my hands on your shoulders. I want you to shrug your shoulders as I push on them. Okay. And now I'd like you to, I'm going to push my hand to your cheek, and I want you to push your head. Okay. Now push against resistance. Alright. At that point, I was assessing cranial nerve 2. Now I'm going to palpate the trachea and the thyroid. First, I'm going to palpate the trachea. Alright. I'm moving it left and right, and I'm checking to make sure that it's symmetrical and it does not deviate to the left or the right. Now I'm going to ask the patient to take a sip of water. Hold on, let me get behind you. As he takes the sip of water, go ahead. The trachea should move up when he swallows. And it does. I'm also, okay. As I'm behind the patient, I'm also checking for the size of the thyroid. Which is normal. Next, I'm going to check for the carotid pulse, one side at a time. Any tenderness noted?
No. No.
Okay. And next, I will auscultate for carotid bruits.